anxiety has always been our most prevalent issue in service. I mean, even more so now, but that's certainly been a constant. So having an anxiety-based CBT program that we could offer to young people, again, just felt such a helpful additional offer to our service model. So that's now very much an integrated part of our offer. Consultation is really key in terms of with, again, school staff, professionals, parents, carers, to support the work. We also do group-based support as well as kind of assessments and formulations as well for those referrals where, you know, it's not always clear what's going to be the most helpful offer of support. I mean, predominantly, it's early intervention. You want to be able to offer that as soon as possible, really. So in theory, you'd have it very much at your front end of the service offer, but it's so, I guess it kind of works so flexibly. So, for example, if we receive a referral for a young person where it's an anxiety presentation, if they're open to giving the offer of the programme a go, and they're motivated to do that, we would try and get them on as quickly as possible, you know, within a week of receiving the referral. So it's absolutely been key for us in terms of managing waiting lists as well, having the digital offer as part of our service offer. For a lot of young people, it works great as a sole intervention, but for some who are maybe on a waiting list for the one-to-one therapy, for example, they could have that as an initial offer whilst they're waiting, and then again, you know, be offered the face-to-face therapy when that is able to be offered to them, and they will have had those strategies and insight from the programme whilst they've been waiting for that, which again we found has been really key in terms of that support for that young person. There's been another 2 programmes that have developed whilst we've had the offer, which is to support parents in terms of supporting their anxious child or teen. So again, we're able to offer, for example, you know, face-to-face therapy to a child or young person, and the parent carer could be working through the Supporting Your Anxious Child or Teen programme at the same time, which we found to be really effective as well. So, you know, you can really integrate it within your service model in a way that yeah, I guess feels is best meeting the needs of those children and young people. Again, I think particularly for young people, they're so their world is very often through communicating through devices and things, and the programme, again, you can download the app to you know, to any sort of device, mobile phone, tablet, for example. So I think it feels very accessible. Like anything, you know, even such as counselling and face-to-face therapy, you know, they've got to want to do it. But you soon know, because obviously that conversation is had, and I think it just gives more choice for some young people who prefer you know, that way of working. They can access the programme at any point that suits them, you know, so again, it's not set to a particular sort of session time. So yeah, we find just having that additional offer just certainly gives more choice. Absolutely. So for the Leeds MindMate Wellbeing contract, we had to go through a procurement process, and one of the key elements of that was that we would be using a patient management system that could, you know, reflect our service offer and pathways, but key could collate the data and successfully flow it to the mental health services data set. So we were working with Maiden and the iaptus CYP. We'd already started to use it within our Calderdale service because of those reasons. And we agreed with the Leeds CCG to pilot it prior to the Leeds MindMate Wellbeing contract starting. And we were confident that we would successfully, you know, it'd be a successful system for us to be using as a provider. So when we were selected as one of the providers for that contract, and have used iaptus CYP from that point onwards as a service and as a team. And another element which has been developed between Maiden and Silver Cloud is that we can now reflect all of our Silver Cloud data. The two systems communicate together as well, so that all of that data gets pulled through. And that is a substantial sort of obviously offer within our service now. In terms of things like our digital offer, there's some new programs that are going to be available from next year as well. So we'll continue to develop and diversify in that way as well.